Cut out, I'm picking up where I left off. So there are reservoirs for infectious agents in healthcare settings, right? Other patients are constantly shedding skin cells that might have pathogens attached. There's bodily secretions and excretions. And remember, a lot of gram-negative rods can thrive in places like sinks, respirators, toilets. Remember, our honey badger friend Pseudomonas can actually grow in a lot of different disinfectants, so it's very hard to get rid of. And when you look at a number of healthcare infections, they're actually coming from contaminated soap and disinfectants. Healthcare workers are another source of disease. If you go to work sick when you're a nurse, you can be carrying a pathogen that you can give to a patient. Also, you can look at the patient's own microbiota. If they have an invasive procedure, you can actually introduce bacteria to a part of the body where they could not be found normally, and especially with a compromised immune system, they just can't deal with that. In terms of transmission, you can have direct transmission. This usually comes from healthcare personnel. You have to wash your hands, you have to disinfect, you have to wear gloves. You can also have transmission through fomites. When you're dealing with things like IV lines, catheters, respirators, if they are not sterilized correctly, you are totally introducing contamination to the patient's body because those devices breach the first line of protection our bodies have against letting pathogens in. You can also have airborne transmission. Usually you deal with this by reducing air pressure, by mopping instead of sweeping, and by using HEPA filters to remove particles. So it is really important to prevent healthcare-associated infections, and you do this by having the right detection procedures, the right policies in terms of washing hands and disinfectant techniques. Most hospitals actually have an infection control committee that actually will implement policies based on how the CDC has established their rules. So the Healthcare Infection Control Practices Advisory Committee actually creates precautions and laws that hospitals then create committees that enforce those rules basically and come up with how they're going to follow those procedures.